You're
Well,
ready.
the first thing is, I like what Wendy Sue Swanson, Dr. Swanson has said about getting physicians involved in producing content or even taking your content, amplifying it, spreading it out there in the social digital world. She says you have to do one of two things. You need to either pay those physicians, and there are certainly a few institutions that recognize the value in that and the contribution to the bottom line, but that's still rare. Or you have to at least support them in some way. Give them the opportunity, give them time, support them in other ways as well. You don't want your most expensive asset in the entire system out there doing clerical work, essentially, and finding images or writing blog posts or whatever it is, setting up profiles on their pages. You want to do that stuff for them and then have them check it for accuracy. Have them be the editorial staff, essentially, for accurate medical and technical oversight. And if you can do that, do it mostly for them, then the next step is to include them as part of your content. That is, put their name on it. Use them as the byline. Because your patient community doesn't want to connect with you, the marketer. They don't want to connect with your copywriter. They want to feel like as they're reading this or as they're watching the video, they're establishing a relationship with the doctor. Okay. Now you can expand this to include other employees in your organization, like your nurses. That's pretty good, or some other people, your dietitians and registered dietitians and what have you. But most people, when they're sick, they mostly want to connect with their doctor. So try to include them as much as possible.